Thank you, Darren, for overview of what Miram does and for your team's dedication in finding a treatment that actually can improve quality of life in our patients. So thank you for supporting us and for being here. I will introduce our next speaker. It's my great pleasure to introduce Jasmine West, who I completely just enjoy working with her in the last few months in bringing this program to life. So Jasmine brings a background of public health community engagement program leadership to her role at PSC Partners as the director of the community engagement and programs. She has tremendous experience across local, national, and global health initiatives and has worked alongside clinicians, researchers, and patients, focusing on promoting equitable access to care and giving a voice for those that are not heard. At PSC Partners, Jasmine focused on building, again, meaningful relationship across the PSC community, supporting education and outreach efforts, and fostering a partnership that drives improved patient outcome, and at the end, finding cure for PSC. So welcome, Jasmine.
All right, good morning, everybody. Official introduction, Jasmine West, she, her pronouns, Kadis did the rest. So let's see here. I think majority of folks in the room and connected virtually are familiar with PSC Partners, but you might not know the depth of what we do, what's available to you, so I'm just gonna provide an overview of some of the things that we have to offer. I have been with PSC Partners since October, and I would like to give a shout out to Joanne Hatchett, who has actually been a wealth of institutional knowledge, resources, and really a mentor as my onboarding eased into this position. So thank you, Joanne. We are a small but mighty patient-led nonprofit. We're driving sizable impact, and with that, I want to share our mission and global impact. So we're driving research to identify treatments and a cure for PSC, and with that, our global impact, we're a globally recognized organization. We connect with a community of patients, caregivers, clinicians, and researchers with the same goal in mind, which is to advance the search and a cure for PSC. So we have different pillars that support this mission, that have that impact. You can see on the left-hand side, we have patient education and support, research programs and grants, and then our patient registry. And of course, when you have pillars, you have sub-pillars, you know, that kind of have this ripple effect, but these are the ones I'm going to focus on for today. So patient support and education, this is the first pillar, and we have everything from an annual conference to regional convenings, as you are here today. We have peer support, mentorship, Zoom rooms, Facebook groups, just to gauge audience interaction. How many of you have been part of a PSC Partners Zoom room, the support group? All right, a handful of, for virtual folks, a handful of hands went up here. Maybe you raised your hand virtually at home. You're like, yeah, I did too. But for our Zoom rooms, we actually meet monthly, depending on topic. It could be bi-monthly, but it focuses everything from a teen support group to folks who are in their 20s and 30s. We have spouses and caregivers. We have a liver transplant breakout room. So really, it's a space where folks come together. You know, they can share what they had for lunch, or they can share their PSC journey. It's just really whatever folks want to bring into that space, time and day. We have our Facebook groups. We have an open one, a closed one. It's really a space for people to come together, share their stories, and ask hard questions. There's a really strong, tight-knit community that's part of these groups, where folks walk away with solid connections that they can lean on. Webinars, we have them quarterly, various topics, led by different key players in the PSC community, and I'll elaborate on that in this slide. How many of you have been to a PSC Partners annual conference? Raise of hands. Okay, y'all. Look around. That was more than have been to the Zoom rooms. So you should join the Zoom rooms. That's fantastic. Our last one was in Denver, a year before that, Phoenix. We have one every year. And it's really what the community has said about it. I made note here. is they describe the conference as a family reunion. It's really about folks coming together, this highly valued experience of networking within the community. You have folks who are newly diagnosed being like, wow, as somebody who actually gets it, right? And then you have folks who have been going since the very beginning where they just catch up and are able to be a part of the community at this annual conference. This year, we're doing it in partnership with AASLD. It's the American Association for the Study of Liver Diseases. AASLD is a international conference that happens every year, and this year it's in our own backyard. So Denver, Colorado is a very unique opportunity for us to collaborate with them, say, hey, we're having a PSC-led community day, and then work in partnership with them for the patient-led sessions, different advocacy and research-focused tracks. So if y'all want to come to Denver in November, that's where we're having our conference this year. We also have our 2026 new initiative. It's the PSC Connected to Care Summit. As Audra had mentioned earlier, San Francisco is our soft launch to that, so thank you for being a part of it. Up next, we have LA, Chicago, and New York. And again, to her point earlier, just any feedback that you have, how we can improve, what was missing, topics that need to be included, please let us know, so that way the summits between LA, Chicago, and New York are exactly what they should be. Our upcoming webinar is from Donation to Recovery, Real Stories Behind Liver Transplant. This is actually part of your centerpiece. You can scan the QR code to register. But on the far left here, we have Yvette Matthews, who's a transplant recipient, and she's been part of the Transplant Games of America. And I think Denver, Colorado is this hotspot this year because the Transplant Games of America are in Denver in July. So we're going to have PSC visibility there with a handful of folks who will be in the background but also actively participating in them. In the middle here, we have Brooke and Michelle's connection. Brooke is actually a living donor, and Michelle is a transplant recipient from Brooke. I wish I could tell their story, but I also want to intrigue you to join the webinar so then you can hear the story. It's a really unique, special story. It started in 2024, but join the webinar. You'll hear more, so no spoilers here. And then we have on the far right, John Crowley, two-time transplant recipient, and he'll also share his perspective. So lots of good stuff that's happening. This one is April 28th, so please join us. In regards to research, as a patient-founded and patient-led organization, we have patient voices that are guiding the research, our priorities, our programs. You can see here, this is just a lot of puzzle pieces that are connected because it is our research wheelhouse. It helps inform our research strategy. This is available on our website, so every puzzle piece that you click, it elaborates on exactly what we're doing, how we're doing it, and the outcomes from it. I do want to give a shout out to Steve Rossi, who is right here. He is our Chief Scientific Officer at PSC, who oversees the research team and has his foot in all of these puzzle pieces. Just an example of a few of them, ICRN, International Collaborative Research Network. This brings together global experts for patients at scientific convenings and global networking. Our WIND project is it prospectively collects real-world data to support PSC drug development. Symptom assessment program developed the first PSC-specific symptom measurement tool, which we have Dr. Yvonne, who will elaborate on that later today. And for the patient registry, I will dive into that. So, how many of you in this room are part of the patient registry at PSC? And excuse me, I was actually going to say that the registry is a secure online platform to amplify your voice in PSC research. I would like to give a shout out to Brian Thorson, who is our director of the registry. And so once you're part of this registry, you can actually document and track your medical history with PSC. This includes treatments, symptoms, healthcare providers. You can complete different surveys that help inform the experience that address key questions in PSC research. We do have examples of surveys that have gone out, have a tremendous response rate, and help inform how we move forward. And then you can also elect to receive information about participating in research and clinical trials. You can be notified if you qualify for the study and choose to reach out to that contact study team. So privacy is protected, no identifying information ever leaves the registry, and here we have that, if you're a caregiver, you can sign up on behalf of the kiddo. We have 2,800 participants, representation from 54 different countries, and it's available in English, French, and Spanish. We have other translation that is forthcoming in the next however long, but it is underway. So to get involved, y'all are here today. Thank you. You can join a support group, participate in the PSC registry, attend a webinar, different events that we have going on, share your story, stay engaged between the newsletter, social media, and spread the word, really, between, fundraising, donating, active participation. Patients aren't just participants, we're partners. So really at PSC Partners, we want to partner with all of you. Contact us, feel free to reach out whenever. But with that, we're going to keep the show going. So I would like to introduce Benjamin Miller in the room somewhere. Here we go. All right, so Benjamin Miller, Vice President and Liver Portfolio Development Lead at Ipsen. He oversees clinical development for rare cholestatic liver diseases, including PSC. His work focuses on advancing clinical trials, partnering with clinicians, researchers, and patient advocacy groups to ensure patient perspectives are reflected in drug development. So welcome, Benjamin.